So I'm going to be talking to you about tackling antimicrobial resistance from a human health perspective. I mentioned earlier that I'm the lead pharmacist for the HC and AMR division at Public Health England. So antimicrobial resistance, why is it a global and public health and clinical priority already? And some of the slides I'm going to share with you are brief. The pictures are brief, but I will talk through some of them with you. So, and I've got about 15 minutes to get through my session, and then I'll hand over to James. 1 in 3 patients in a hospital in England are on antibiotics at any one time. Actually, that's very similar to the European statistic as well. And 1 in 3 individuals will take a course of antibiotics in a year. So if I ask you now, and I'm not going to ask you, but if I ask you who has had an antibiotic this year, I can almost bet that about 1/3 of you will say that yes, you've had an antibiotic this year, or a member of your family have. That's usually what we get in terms of the statistics. So antibiotics are critical and important for us to keep them safe. But it is already an issue. So we often talk about antimicrobial resistance, and people think it's a future challenge. So when we talk about antimicrobial resistance, we are talking about antibiotic resistance. So that's obviously antibiotics are tackling bacteria, antivirals are for viruses, antifungal for fungi. But when we talk about antimicrobial resistance, that's the broad term we use for the resistance of any of those microorganisms. We know that the resistance occurs naturally through these organisms, but actually sometimes there's a selection pressure that we put on them as well through the use of these medicines. But it is already here, so you would have seen several headlines such as drug-resistant strain of gonorrhea spreading, the latest one about Candida auris, where 8 Britons have died in UK hospitals. TB stats, that's really scary as well, both in the UK and abroad as well, where we've got to the stage now where there are 480,000 recorded cases of multi-drug resistant TB. Again, more slides on that. Woman dies from infection resistant to all available antibiotics. You know, these sorts of headlines make you think, well, yeah, it can never happen to me. It's somebody else's problem. But, you know, for me as an individual, about 4 to 5 years ago, I listened to a documentary about a child who was very active in sports, was at home, you know, didn't have access to hospital, wasn't in the hospital, was just a normal child playing, very active in all the regional sports. And she had a scratch on her. I don't think she even knew she had a scratch. But what ended up happening was that a few days later, she ended up in hospital. She ended up having sepsis, but the bacteria that caused her infection were resistant to all the antibiotics that were available to her easily at that point. She ended up having double lung transplant and ended up in a wheelchair. She's now 21, or a little bit older, but she's at that stage where she, you know, they've told her she has to live within the vicinity of a hospital because she always needs to go, she'll need attention a lot. And for me, when I listened to that, it really brought home to me because at that point I had 1 child and I think I was pregnant with the other one. And I really just thought this can happen to anybody, literally, because there was no reason for her to have a resistant infection. And there was another case when I was working in a hospital of a child who sucks their thumb and basically had a little bit of a small injury on her thumb, I think, or through sucking, and you know, ended up having again resistant infections through that, and got to the stage where the thumb was having to be cut off. Again, that's petrified me, and I have a child now who sucks their thumb, so I'm constantly saying, have you washed your hands? Have you done this? And have you done that? Because of that worry. So I'm not saying that to scare you, but the truth is that it's a reality, and there is a reason why everybody needs to do their part to take action. So the future also, if we don't act now, is that it will lead to 10 million deaths by 2050. That's the estimation that's been made, and at the point of doing the calculation, 66 trillion pounds, it was $100 trillion was the estimation done, but that the deaths from resistant infections will be more than cancer. And as you can see there where the burden of that resistant infections will be, there will be some in the UK where we are but it will be across the globe. And we all know now that actually it is very easy to get anywhere in the world because of air travel. Resistant infections will also impact on sustainable development goals. So for those of you that are public health, you will probably understand this even better than most of us, but this is how the UN, WHO is really considering how we ensure that all countries have an opportunity to thrive. And so antimicrobial resistance will affect, those who are in the poorest, will strike hardest on poor treatment, where there's poor treatment of resistant infections, and that's going to be more expensive. So obviously one of the sustainable development goals is that there will be no poverty, there will be zero hunger, but again, resistant infections in animals threatens food production. Clean water and sanitation, preventing infection is critical. So actually, there is a lot of work that needs to be done there as well around ensuring that we have clean water, access to clean water and sanitation. So out of the 17 Sustainable Development Goals, antimicrobial resistance will impact on 7 of them. Everybody has a role. The government has a role. Professional bodies have a role. Organizations, public health agencies, healthcare professionals. So you are future healthcare professionals. Actually, even as students, you already have a role. And as I said to you earlier, the reason why we have a national student conference is because of another student who in 2017 decided he wanted to do something to support his peers. The public have a role and pharmaceutical companies have a role as well. We do know, though, that even if we develop a new antibiotic today, and actually there's been no true new class of antibiotics in the last 30 years, there's been mixtures of classes, but no new true class, resistance will only happen very, very quickly, because if we don't use them prudently, then actually we will have the resistance occur within a few months to a year. Tackling antimicrobial resistance, though, is critical, and that's being done globally. Often we hear, so what's happening in the other side of the world? Well, even if we take all the action in the UK and make sure we've done all our parts right, but the rest of the world are not doing anything, then actually there's no point. Well, I'm here to tell you that there is action going on globally, and there is a World Health Organization Global AMR Action Plan, which was published in 2015. And there was also a UN declaration which happened in September 2016. And this is where 193 heads of state, so not the health minister, the head of state, signed a commitment that they will work within their country to ensure that they have an action plan to tackle antimicrobial resistance. And also there's World Antibiotic Awareness Week, and for this year that starts on Monday. Usually we have the conference to link up with World Antibiotic Awareness Week. So there is that opportunity, and that World Antibiotic Awareness Week is happening all around the world. It started off because it's always the week in which the 18th of November is, linked to the fact that we've had European Antibiotic Awareness Day for the last 12 years now, I believe. So we now have a World Antibiotic Awareness Week. I talked about preventing infection, that's really key. So worldwide, what's happening around that? There's an initiative called WASH, which is around water, sanitation, and hygiene. And that's trying to ensure that everyone has access to clean water and their sanitation and hygiene, particularly in healthcare settings. It really is worrying. It's quite scary, the lack of access to sanitation in some places. But there's key action ongoing there through WHO and UNICEF. In the UK, what have we been doing? We've had a national action plan. We had a national action plan which ended in 2018. We have a current one that we're working through now from 2019 onto 2024. But that features around the importance of improving infection prevention and control, hand hygiene being really critical, but actually there are other infection prevention and control practices as well. Optimizing prescribing practice, which we often call antimicrobial stewardship, improving professional education, training, and public engagement, which is where an event such as this features and fits in, improving access to and use of surveillance data, and developing new drugs and treatments. And again, around that, UK is also supporting global activities as well. So that was the previous one I shared with you was how the 2013 to 2018 National Action Plan was structured. Going forward, there's now a 20-year vision, and there are 9 ambitions there, and you can see that includes continuing to be a good global partner. Infection prevention and control is there, so minimizing infection, engaging with the public on AMR, also demonstrating appropriate use of antibiotics. So a range of 9 ambitions, and linked to that, there are key actions that are ongoing through national organizations, but also individual local organizations and regional organizations as well. So what can you do to make a difference? So, you know, I like to think simply, and I think it's important. What is the action? Everyone tells you about, oh, you know, this is going to kill and all that. So what action can you take? What can you practically take? You can consider how you and your family use antibiotics. I'm very, very particular with my children particularly, and also those around me, that they use antibiotics when it is needed. And if they've got a cold or a flu, then we don't need antibiotics. I have had challenges where my husband is taking the child off to the doctor, even though I knew that it was not appropriate, but I would not take them. And so we have it's a challenging time where you have to, you're balancing the act of there's an ill child before you, and also could it be something else. So it's really important that people have access to healthcare professionals who can help tell them if they need to worry or not. But you can consider use. You can talk to your family members. You can talk to your friends about using antibiotics. There is currently the Keep Antibiotics Working video. I don't know if any of you have seen the singing antibiotics. So it talks about taking antibiotics when you don't need them, puts you and your family at risk. And also, if you do need antibiotics and are prescribed antibiotics, it is important that you take them exactly as they have been prescribed. Never save them for later or share them with others. How else can you make a difference? You can lead or support a local campaign for World Antibiotic Awareness Week. I know it's next week, but it's not too late. There are resources available for you to use. But one thing I want to say is that you are already here. So you are already making a difference, because actually by you being here, you've all shown commitment to be here on a Saturday. You have taken that first step. So do feel proud about that, and then think about how else can you influence others to do the same. I'm just going to share some examples now practically of how people are doing this. So, you know, educating young children, there's a lot of work that's been going on with Scouts and schools. That's Wolverhampton, but Birmingham as well has done a great work, especially with Rabia and Raki, where they've gone into schools to educate children across Birmingham. And actually the first, there was a student from University of Manchester who also won an award, because that was the first time, probably about 2015-16, that students were going into school to educate pupils about antimicrobial resistance. And these are just some of the posters that have been developed, and that's the Scout badge that was developed in that time. Health students and Higher Education Institute, you're going to hear from Roger today, because he's been doing a lot of work, particularly to galvanize students in taking action around antimicrobial resistance, both in the UK and abroad. So the Tanzania students have been, and iSpare is something that he contributes quite actively with to support students in other countries. And I talked earlier about, this was our first conference at King's College in 2017, and that was the group of students who volunteered, led, and did that. So students are taking action. So through them, you know, they have influence. Now we have about 200 students each year, so that's a minimum of 600 students who we know would have gone on to do more as well. Science museums, so action is going on in different ways. Science museums and museums all over the places, and or galleries are beginning to educate the public around antimicrobial resistance as well. So NHS colleagues, so these are practical ways where individuals are now going beyond their day job and doing something globally as well. So currently there is a program called the Commonwealth Partnerships for Antimicrobial Stewardship, which is running as 12 partnerships, where there's a UK institution, I guess, a UK institution working in partner with another institution or two institutions in Uganda, Tanzania, Zambia, and Ghana. And these are very much, you know, including our NHS healthcare professionals, both within the NHS, but also in higher education institutes who have gone out to these countries to support them in developing interventions to tackle antimicrobial resistance. You can find out about several other positive actions through the shared learning platform that is on Antibiotic Guardian website. And you know, each year there is an award, a conference and awards, or conference or shared learning event, where we give users an opportunity to learn what others are doing. And actually you guys have also had an opportunity to do that, because you've got, many of you have got posters here, and some of you will be presenting shortly to share some of your work. Another way is that, you know, if you're struggling to think, what else can I do? You can look on the Antibiotic Guardian website, because there are several pledges on there, which literally just gives you opportunity to see what else can you do. And there are pledges for students, there are pledges for healthcare professionals, and members of the public as well. And it's a One Health campaign in the sense of that there are pledges for farmers, there are pledges for vets, there are pledges for human and animal health care professionals as well, and pet owners. If you own a pet as well, there are pledges for you. I'm not going to go through this slide in detail, but just really want to encourage you that in addition to your role as you develop and as you qualify and you go into clinical settings, that there are opportunities for you to consider public and global health, and actually you gain skills that are in many ways slightly different or more challenging to what you gain within the clinical setting. And you can do that in addition to your main role. So I talked about the NHS volunteers who are volunteering their time at the moment as part of global health. You gain clinical skills, managerial skills, communication, patient experience, policy, and also not only does it benefit you as an individual, it benefits your organization and also benefits us as a country as well. So just to summarize, by 2050, there'll be more deaths from resistant infections compared to, for example, cancer. Globally, if we leave it unchecked, it's going to affect Sustainable Development Goals. Everybody has a role to play in this. Be part of the change, help keep antibiotics working. I'm going to end by leaving you with a tale about the mold that changed the world. And this is a story that was shared with us about a little boy who went to the doctors with his father. And when he got to the doctor said, I can give you an antibiotic now. I think you have an infection. I can give you an antibiotic now for you to take just in case, or I can wait, or we can do a test to find out if you actually have a bacterial infection. And the 7-year-old said, I'd rather wait and do the test first. And the dad assumed it was because of the taste and he said, no, it's because I watched a theatre program about the molds that changed the world. And so that's basically the story of penicillin and how penicillin became resistant over time. So again, we can make a difference in the lives of young children as 7, as well as students, as well as healthcare professionals as well. Thank you very much.